Welcome back to the deep dive. Today, we are tackling one of those subjects that is, it's completely non-negotiable for parents.
Absolutely.
But somehow, the actual step-by-step guidance feels like this confusing mix of, old wives' tales and shifting timelines.
Mm,
So we are going deep into concrete, evidence-based dental care for children, focusing on the official guidelines, specifically from Australian health authorities.
that is absolutely right. And our listener came to us with an exceptionally strong stack of sources today.
Really top-notch
Oh,
stuff.
yeah. We're talking official guidelines from the Australian Dental Association, key public health resources from Queensland Health, and the practical details about accessing care.
Right, the how-to.
Exactly.
Yeah.
So our mission for you, the listener, is to just carve out a clear, usable timeline. We want you to know exactly what to do and when.
From that very first tooth.
From the very first tooth all the way to, securing that beautiful, permanent adult smile.
And it's not just a few years recovering. This is a journey that spans, nearly 2 decades of development?
It is.
So the core knowledge we need to extract today isn't just what happens, but the how and the why.
The why is so important.
Why are certain habits so crucial, and where can you find the professional support you need?
Exactly. And let's start with a detail that I have to say it really blew me away when I was synthesizing this research.
Oh,
Newborns already have a full set of 20 baby teeth.
wow.
They're completely developed, just hidden in the gums. They grew while the baby was still in the womb.
So dental care isn't something that starts at 6 months when you see a white cap.
Not at all. It's a process that begins before birth, which makes that first stage of life just incredibly important.
That context changes everything, doesn't it? Because you realize you're protecting a structure that's already fully formed.
That's it.
Okay, let's unpack this. Let's start with the infant stage, so from birth until about 18 months. When do those hidden teeth finally start showing themselves?
Well, the timeline is highly variable. And that's the first piece of advice, really.
Don't panic.
Don't panic if your baby is outside the average. For most, the teeth start to emerge between 6 and 10 months.
But it can be earlier or later.
Oh, much. The sources are clear. It can happen as early as 3 months or as late as 12. And that full set of 20 baby teeth, that's usually complete by the child's 3rd birthday.
Okay, so even though these teeth are temporary, we really can't stress this enough. Why do we need to obsess over them? If they're going to fall out, what's the big deal if one gets a bit of decay?
The big deal is space.
Ah,
Baby teeth are essential space holders. If a child loses a baby tooth way too early, and this is usually from decay,
right.
the permanent teeth underneath, they sense that gap and they start shifting. And that almost always results in severe crowding later on.
So you're setting up future problem.
You are. And beyond space, baby teeth are just crucial for developing proper eating habits and especially clear speech patterns. They are placeholders and functional tools.
Got it. Now for the rough part. Teething. What are the signs, and what do the sources say about the safest actions to take?
You're looking for the classic signs. Increased irritability, poor feeding, a lot more sucking on, anything they can get their hands on.
Everything goes in the mouth.
Everything.
Okay.
And sometimes, this is an interesting note, they might pull the ear on the side where the tooth is emerging.
I've heard that.
But the sources wisely caution that these symptoms can overlap with other things, minor infections, developmental stages. So don't just assume every cry is a tooth.
Okay, let's address the elephant in the room. Teething gels. I know so many parents who reach for them immediately. The sources were pretty firm on this, weren't they?
Very firm. Teething gels are generally not recommended.
Not at all.
The primary issue is twofold. First, they often don't actually ease the pain that effectively. And second, they carry genuine risks, especially with dosage control and potential harmful side effects.
So what do you do instead?
The recommended actions are really simple. They're mechanical and safe. So gently rubbing the gums with a clean finger, or giving them something firm and cold to chew on, a sugar-free rusk, or a teething ring that's cold but never frozen. That can cause damage.
It just emphasizes that sometimes the simplest intervention is the safest.
And most effective.
So once that first little tooth cuts through, the cleaning regime starts. What's the protocol here?
Cleaning starts the day the first tooth appears.
The day.
You don't need fancy tools. A small, soft infant toothbrush, the ones designed for under twos, or even just a clean, damp face washer or gauze wrapped around your finger, that works perfectly.
And the toothpaste rule for this entire phase, right up until 18 months, is incredibly strict.
It is. From that first tooth until they turn 18 months old, the rule is to use only water on the toothbrush.
Only water.
Yes. unless you have been specifically told otherwise by a dental practitioner. This is critical because infants can't spit reliably, so we want to limit how much fluoride they ingest.
That makes sense. And that water-only phase, it brings us to a crucial transition. Let's move to the toddler phase, 18 months to about 5 years. What's the big switch at 18 months?
This is when we bring in fluoride, assuming you're in a community with fluoridated water, which is common in Australia.
Right.
At 18 months, you transition to a small smear or pea-sized amount of low fluoride toothpaste. It's often labeled children's toothpaste for that reason.
Because it's a lower concentration.
Exactly. Roughly half the fluoride of standard adult paste.
Now, here's the rule that feels like fighting a natural instinct, especially with a thirsty toddler. The post-brushing rule, you're telling me we can't rinse.
That's exactly what the source is for.
And no drink right after.
No. And it's so important to understand the why here. You want that protective fluoride layer to stay on the enamel for as long as possible.
Of course.
If you immediately rinse with water or give them a drink, you are literally washing away the benefit. The key instruction is just spit out the excess paste, but do not rinse the mouth. It's a habit we have to build from day one.
We've all been there fighting the alligator roll on the bathroom floor. When you're talking about brushing technique for a toddler who is actively resistant, what practical advice did the ADA offer on positioning?
Positioning is everything. If you can't see, you can't clean.
Simple as that.
The recommended method is to have them secure, maybe sitting on a lounge with their head lying back securely on your lap.
So you get a clear view.
A clear line of sight. And for the technique itself, you want soft, circular motions, like a jiggling motion, on all the surfaces, and make sure you gently brush right along the gum line.
And for the parent listening, the question is always, when can I stop doing this job? When do they get their independence?
This is a milestone that is often reached way too early, according to the data. Parents should be actively helping and supervising until the child is about 8 or 9 years old.
8 or 9? That's older than I would have thought.
Yeah, it is. But the sources offer this fantastic and memorable reference point.
Okay.
It's when the child switches from using a pencil to a pen at school.
Oh, that's brilliant.
That change signifies their fine motor skills are developed enough to do the job properly on their own.
Pencil to pen. I'll remember that. Okay, let's pivot to the biggest decay factor. Diet. We all know sugar is bad, but tell us about the specific mechanism of decay in infants. I was surprised to learn babies aren't born with the bad bacteria.
That's the critical insight, isn't it? Babies are born without decay-causing bacteria.
So where does it come from?
It's passed to them from their primary caregivers. And it happens through these seemingly harmless, common habits like cleaning a dummy by popping it in your own mouth first.
Or sharing spoons.
Exactly. Sharing spoons. You're transferring bacteria from your mouth where it's established to the child's clean mouth where it then colonizes.
So this is genuinely a family health issue, not just the child's personal hygiene.
100%.
And if we're talking major danger zones, the bedtime bottle seems to be the one that's most strongly emphasized.
Absolutely. This is probably the highest risk activity. You should never put a baby to sleep with a bottle of milk, formula, or juice.
Why is it so bad?
It's a lethal combination. The lactose or sugar pools around the teeth, and when the baby's sleeping, saliva production just plummets.
And saliva is the defense.
Saliva is our natural defense. So, reduced defense plus pooled sugar means the decay risk just skyrockets. Dentists call it bottle rot. And on the same note, never dip dummies in honey or sweet liquids.
Moving to older toddlers, parents are trying to provide healthy snacks, but sometimes the healthy labeled things are the worst offenders because they're so sticky.
Yes, the triple threat. Sugar, stickiness, and acidity. Foods with high concentrations of sugar that stick to the teeth are major culprits.
Like what?
Think about those convenient snacks. Muesli bars, fruit roll-ups, even flavored rice crackers, and anything with added honey. Honey is just another form of sugar that is incredibly sticky.
So what are better options?
Fresh fruit, raw vegetables, cheese, hard-boiled eggs, things that require chewing, stimulate saliva, and don't just cling to the enamel. You really have to scrutinize those labels.
Excellent. Now we bridge into the big changes ages 6 to young adulthood. The mouth becomes a construction zone. What's the timeline here?
The excitement usually starts around age 6. Baby teeth get loose and wiggly, typically starting with the lower front ones.
Right.
By about age 13, most kids have shed all their baby teeth and they've been replaced by the permanent set.
But let's pause on the very first adult teeth. This is where I think a lot of parents get confused. Do we have to wait for a baby tooth to fall out for the first adult teeth to come in?
And this is the most critical dental surprise. The answer is no.
Oh.
Around age 6, the first adult molars, all 4 of them, erupt into the mouth behind the existing baby teeth.
Behind them.
Yes. No baby tooth needs to be shed for this to happen. It catches parents off guard.
Ah.
And because these new molars are tucked way in the back, they are highly susceptible to decay.
Because they're hard to reach.
They're hard for kids and even parents to reach effectively. They're brand new, unprotected, and they need immediate attention.
That just reinforces that good habits must be in place before that age 6 milestone hits.
Absolutely.
Okay, once we hit the wiggly tooth stage, the gaps are closing, which brings us to flossing. When does that need to start?
Flossing is necessary once a child has at least 2 teeth touching side by side.
Makes sense.
If there's no gap, the toothbrush can't clean those contact points. And don't be afraid to use tools like flossettes. They can be incredibly helpful for kids or for parents assisting them.
And looking ahead to young adulthood, what's the final count we expect to see in the mouth?
The sources indicate most people, fully developed, have 32 adult teeth around age 21.
16 top, 16 bottom.
Exactly. But it's very common, due to evolution and smaller jaws, to only have 28. The wisdom teeth often just don't develop, or they don't have room and need to be removed.
Right. Which brings us to our final segment, utilizing professional care and resources. If we've been following all the rules at home, when should a child have their very first dental visit?
The Australian Dental Association is very clear on this. The first visit should happen when the first teeth appear, or by 12 months of age, whichever comes first.
That early.
That early. And that first visit is often just about familiarizing the child with the environment and educating the parent. At the absolute latest, a child should have seen a dentist by age 3.
And what about the regular schedule after that?
Young children are generally recommended to visit every 6 months.
6. Wow.
Yeah, because their teeth are erupting, their bite is changing, and decay can progress very, very rapidly. Once they're older, if they have excellent dental health, the dentist might suggest moving to a 12-monthly schedule.
This raises another timing question. If we suspect our child might need braces down the road, when's the right time to check that out?
Don't wait until all the adult teeth are in. The Australian Society of Orthodontists recommends a checkup between the ages of 7 and 10 years.
For early intervention.
Exactly. Catching issues early can sometimes simplify or even shorten the